ਐਲਬਰਟਾ ਦੀ ਚੀਫ ਮੈਡੀਕਲ ਅਫਸਰ ਡਾਕਟਰ ਡੀਨਾ ਹਿੰਸ਼ਾ ਨੇ ਸੂਬੇ ਅੰਦਰ ਚੱਲ ਰਹੀ ਕੋਵਿਡ ਮਹਾਮਾਰੀ ਲਈ ਸੂਬੇ ਦੀ ਪ੍ਰਤੀਕਿਰਿਆ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ ਹੈ। ਡਾਕਟਰ ਹਿੰਸ਼ਾ ਨੇ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ ਕਿ ਸਰਕਾਰ ਪੀਸੀਆਰ ਟੈਸਟਿੰਗ ਨੂੰ ਉਹਨਾਂ ਸਮੂਹਾਂ ਤੱਕ ਸੀਮਿਤ ਕਰ ਰਹੀ ਹੈ ਜਿਨ੍ਹਾਂ ਨੂੰ ਹਸਪਤਾਲ ਵਿੱਚ ਦਾਖਲ ਹੋਣ ਤੇ ਸਭ ਤੋਂ ਵੱਧ ਜ਼ੋਖਮ ਨੇ।
For the last 24 hours, we have identified 5,384 cases of COVID-19 and completed about 13,879 tests. Our positivity rate for lab-confirmed COVID is about 38%. There are currently 635 people being treated for COVID-19 in hospital, including 72 in the ICU. I want to note that starting today, our historical ICU numbers may look a little different for a few dates in the past. As we have been doing continual quality assurance work with our data, it was identified over time some units in some hospitals have shifted back and forth between being available for use as an ICU unit or a non-ICU unit. In some of our historical data, patients admitted for COVID treatment were categorized as being in ICU when the unit they were on, in fact, had been changed back to a non-ICU unit at that time. The adjustments you will see in historical data today now reflect correctly the type of care those patients were provided. This means you will see a decrease in ICU numbers at some points in time, with a corresponding increase in non-ICU numbers. With our recent increase of Omicron cases, demand for PCR testing has pushed our testing system beyond its capacity. As many Albertans have found, just getting an appointment for a swab takes several days, and the time to get results back is now close to 48 hours after the swab is taken. While we have used widespread PCR testing to manage COVID-19 in previous waves, this approach is just not possible with the Omicron variant. In order to ensure that patient care decisions are supported by timely diagnostic information, PCR testing eligibility will now be focused on those with clinical risk factors, for severe outcomes, and those who live or work in high-risk settings. Effective immediately, PCR tests will be available for only those in specific categories. The full list can be found on our website, but some examples include continuing care residents, healthcare workers and staff in acute and continuing care settings, shelters and correctional facilities, symptomatic household members of a person who works in continuing or acute care, individuals with any degree of symptoms who have risk factors that would make them qualify for monoclonal antibody treatment if positive for COVID-19. This list is available on the website and includes those with significant immunocompromising conditions.